Hi, this is Deb, and I am here with my dear friend, Dr. Jason Deyo, here. And we are coming together because I've actually been working with Jason now for a couple of months, and on my nutrition and on being able to have a positive experience and relationship with food and my body in a spiritual way. And just before we started the recording, Jason actually, we just had a little meditation before we dropped in and spoke about this, and something actually came up for you. I'd love for you to share that.
I was just thinking about the Serenity Prayer, which I hear in use a great deal in food recovery. I'm no Dr. William D. Silkworth, but I've been on the firing lines with nutrition for decades now, and I've seen some heartbreaking cases. And one of the first things I try to bring through for people is to determine what do they have power over and what do they need help with. Being able to define that is helpful in the beginning. Just from a very physiological perspective, if there's anything we can do from that starting point that we do have some power over to control our cravings throughout the day for foods, we should identify that and explore it. And again, as the Serenity Prayer says, the wisdom to know the difference between what we have some control over and what we can't. Therein lies the difficulty. But I'd just like to explore for a few minutes any tips on what we can do physiologically to point us in the right direction.
Yeah, absolutely. And I mean, and you guys know that for me, being in food recovery has always focused primarily on my spiritual growth. And having done the steps a number of times, and every time I go back into it, I'm always getting to new layers of truth and new layers of honesty. And what started to emerge for me was I feel like I now have the spiritual stamina to be able to get um, more focused on like what my body physiologically needs. Because before, when I was in my my compulsive overeating or my restricting mindset, I would immediately go into the obsession around like weighing and measuring, and around like things being the right food or the wrong food, and I'm being good or bad, or I'm like you know what like I just had like all the junk around it. And I felt like I was finally in a place where I I could address it in a healthy way. And so after some prayer and meditation, I was guided to work with Jason. And I want what really I found compelling when we first started talking together was you were talking about abstinence, and when a lot of folks find you who are in program who have food issues, like a lot of them have been sort of put on a food plan or an abstinence plan that their sponsor gave to them, or maybe that the group that they're a part of stipulates. And what I found very, very illuminating was you just speaking about that for a little bit.
Great point. Um, I have a lot of people who come to me from a recovery place, and they're finding it really difficult to be compliant to their abstinence program. Um, and when I take a look at what they're eating, I'll take a quick look at, without getting into blood work or A1C or glucose levels, but really easy self-diagnosis tools of just two words: better or worse, right? Two really simple questions. How are you sleeping, number one, and B, how do you feel after you eat? And the responses to those questions make it really plain as day what's going on with your nutrition program. For example, if you immediately crave sweets after you eat, I know that it's a negative effect on your blood sugar, right? Blood sugar goes up really quickly, it comes down really quickly, you become hypoglycemic. That usually tells me one of two things. Either you've eaten too many carbohydrates, or you've eaten just the right amount of carbohydrates, but you didn't include enough protein to balance and slow down the digestion. So without giving a lecture on insulin response, just making it really simple, nice, healthy, slowed down digestion where foods come into the intestine and slowly trickle into the bloodstream to give you nice, stable blood sugar is the effect we're all looking for. So if you don't have stable blood sugar, if you have blood sugar swings, right, your blood sugar goes up, then you're irritable, right, or you become sleepy, or blood sugar drops, now you're irritable again, right, hungry, angry, lonely, tired, right, restless, irritable, discontent.
We know that one, right?
Okay, so the goal is to try to determine how much of that is in the spiritual malady and how much of that is purely a physiological response.
See, that I found really fascinating.
So my goal is to help people find whatever power they have over their physiological response and jump into that. And the very first thing you can do to try to figure this out for yourself is start adding protein to breakfast. If you're a wake up and you're an oatmeal eater, fine, you get to keep being an oatmeal eater. You just have to add some protein to breakfast. You do that for a week and then just ask yourself, simple question, better or worse, right? Do I have more stable blood sugar? Do I have less cravings? Am I able to focus more clearly throughout the day? When I go into meditation, can I stay in meditation for 15 minutes or is my mind wandering all over the place? Really simply subjective questions to just, you don't have to look at your blood work to know, how is my food affecting me? Because if the food you're eating is producing these blood sugar swings, these highs and lows, how do you expect to stay abstinent? How do you, when you're having a blood sugar swing, your blood sugar drops, you're hypoglycemic, you're jittery, you're irritable, you're uncomfortable, you need something to take that feeling away, and then your sponsor tells you, nope, sorry, you have to wait 4 more hours to eat, you're on this given plan. You're gonna struggle, you're gonna have a really hard time with that, and I think there's an easier, softer way.
That's awesome. And the last thing that I want you to share about this, because this I found so compelling, because I started out, the food program that I started in was OA, and I remember seeing something, they weren't very, very strict with it, the particular group that I was a part of, so I don't remember seeing this a lot, but I know that there was like something that had circulated around that was like, talking about like, a serving of starch, a serving of protein, a serving of, like it had like servings, and like that was kind of what like a suggested menu plan was for your day, and it really had servings of each thing. And what I found really compelling is that you were saying, well, not everybody necessarily does well with that cup of oatmeal in the morning.
Sure. Half the people who walk into that program are going to have amazing results right off the top, and you can see them. You'll look around at the room at your meeting and you'll say, whoa, half of these people they've seen weight loss, right? Like their skin's glowing, they've improved, right? They used to fall asleep and now they're just feeling energetic. I can see the results. And then there's other people in the room who are eating the exact same food plan, following the same abstinence, the same serving size. They're gaining weight. Their sleep's not improving, right? Their skin's not glowing, right? And it's pretty easy to tell, well, listen, it's that quick question. How are you feeling after you eat? There's no perfect one-size-fits-all, but it's not too difficult to figure out which it is. Like, take that one serving size, for example. Take a cup of oatmeal, right? Maybe I've got a small area of highly athletic patients who need more than a cup of oatmeal to fuel their exercise, right? And then there's the rest of us that sit at a desk all day and talk, okay? A cup of oatmeal for those people is really broken down. If you have extremely stable blood sugar, if you haven't done any damage to your pancreas, insulin, cortisol response, if you've really clean bill of health, great glucose control, great A1C values, you can probably tolerate that oatmeal. And to add a little bit of protein, you might just need to add a couple of walnuts, right? Again, better or worse. Did that improve your blood sugar? Did you see weight loss? Is your life improving? Can you think clearly 4 hours after that meal? If the answer is no, you need more than a couple of walnuts. You're going to need an egg, maybe 2 eggs. Ask again, right? Because if that protein didn't stabilize the blood sugar from that serving size of oatmeal, now we're able to identify that's too much of a serving of oatmeal. Your blood sugar is too high or too low. So we're going to have to, you still need the calories for breakfast, right? So this isn't about starving you. It's about finding what gives you, your body, this is how you need needs,
Mm-hmm.
giving you the nutrients you need to be your best.
Whether that's fats and
What-
proteins
Or carbohydrates.
or carbohydrates. Okay.
So once you've added protein to a carbohydrate meal and found that you're still not seeing the improvements you want, now we know that we have to start reducing the carbohydrate content and raising the fat content. And again, it's trial and error. It's individual trial and error. You go to half of a cup of oatmeal, an egg, and then have some avocado or butter or a walnut or a fat to bring up the missing calories that you're taking away from the oatmeal, because no one's here to starve you. We're not here to talk caloric
Right.
deficiency diets, right?
Right.
We want to fill you full of the nutrients that make you the best you can be.
Yeah.
I don't want anyone to feel hungry, ever. We have to
Mhm.
find what makes you feel satisfied.
Yeah.
And then the results start coming in. Sleep starts improving. You start feeling better after you eat. You're more energetic. Your digestion improves. If all those things are not coming out of your mouth saying you're so grateful for how you feel, you're so grateful you found this great diet plan, your carbohydrate to protein to fat ratio probably needs to change just a little bit.
It's so interesting because, I mean, I have to be honest, like, I was super resistant to even look at food for a long time in my program because I'm like, I'm just going to focus on my spiritual development and the food's going to work itself out. And it did work that way in that when I went into meditation and said, God, please guide me, please show me what healthy eating looks like, help me to improve my relationship with food in my body, I was guided to actually work with someone. But, what I want to just clarify here is that this conversation, like, Jason is by no means prescribing what you need to do, and I am by no means insisting that this is what you have to do. I'm simply saying that as someone who has been really, really committed to the spiritual development of this program, and I am a recovered compulsive overeater today. I am a recovered restrictor, and it's really, really helped me. And I'm always looking to go further, and have more freedom and more peace.
Sure, and not to make any diagnoses here and not to prescribe any treatments, but there's an aspect of this program called inventory, okay?
Mm-hmm.
A business that doesn't take stock in trade goes broke. Well, part of your inventory is how are you feeling, right? How do you feel after you eat? How are you sleeping? How do you expect to propel your spiritual life? How do you expect to deepen your meditation if the reason you can't think clearly is because you're hypoglycemic, right? There's a two-way street here, and whatever power you do have over your physiological response to food, let's inventory that. Let's take a look. Can we improve it? Let's improve that. And then from there, maybe our spiritual life will improve.
Awesome. I love that. We will be creating a food inventory. So thank you so much for taking this time out and sharing these few moments with us. We're going to be bringing you a few more videos with various topics around food and spirituality and you. So if you have any comments or questions for Jason, just leave a comment in at the bottom of this video, and we would love to just be bringing more content and more value to those of us who are in food and body recovery, really.
Sure. Debbie, thanks for asking me to come by. I'm happy to share some experience and strength and hope I've had from the other side of working with food addicts and non-food addicts as well, just creating nutrition programs. So I'd love any questions, any theories, any themes you'd like to get to the bottom of. Please fire away so we can answer them. Thanks.
Thank you so much. Take care.